Do you know how pain relievers can worsen psoriasis symptoms? Hey everyone, welcome back. It's your guru for all things psoriasis. Today I want to talk to you about the dangers of NSAIDs, how they can mess up your stomach, and how they can affect psoriasis. This is the final video of our 3-part series on stomach health. So NSAIDs, or non-steroidal anti-inflammatory drugs, are a common class of pain relievers that are used for a variety of conditions such as headaches, muscle aches, arthritis. Some examples that you'll see at the store are Motrin, Aleve, Ibuprofen, and they work by reducing inflammation and pain in the body. These are very helpful for acute pain, but not good for long-term use. Plus, pain is the body telling us something's off and it needs help, not just to cover it up. Problem is that they also have potential side effects that can be dangerous, especially for people with psoriasis. Taking these can cause erosions and ulcers in our gut lining. It can promote intestinal permeability, or what's also known as leaky gut, which causes an overexposure of the immune system to things like food that should be staying in the gut, which then causes an increase in the problem that you're taking the NSAID for to begin with, especially when there's an autoimmune disease in the picture. Then you feel worse and you take more. Just a vicious cycle. Then they increase inflammation. Ironic, I know, since they're meant to lower inflammation, but they increase inflammation when the gut is affected, and that is the problem, especially for people with psoriasis because it is a disease of inflammation. Taking NSAIDs can exacerbate the symptoms and make psoriasis worse. Additionally, some studies have also shown that NSAIDs may trigger psoriasis in people who are at risk of developing the condition. This is because NSAIDs can disrupt the balance of the gut and trigger an immune response that leads to the development of psoriasis. But don't freak out. It's important to note that not all people who take NSAIDs are going to get psoriasis, and it's not necessary to completely avoid NSAIDs if you're someone who does have psoriasis. They are not a good long-term solution to pain, and it is important to be aware of the possible risks and to discuss with your healthcare provider so that you can weigh the benefits versus the risk. So in summary, NSAIDs, non-steroidal anti-inflammatory drugs, are a common class of pain relievers. They're used to treat a variety of things, but they have a potential for side effects. And our focus is especially how they can affect the stomach and the gut lining. And this is just one of the things that can affect our stomach health, which in turn then affects the health of everything else, including the skin. So if you'd like some more tips to support your skin, check out my free guide, The 3-Day Jumpstart to Loving the Skin You're In. So thanks for watching. If you have any questions or comments, feel free to leave them below. I'm Dayna Hrovath with Fountain Mills Functional Wellness, and I'll see you in the next video.